Welcome to yet another edition of the Daily Report. It's Wednesday, November 17th here in Korea. I'm Min Sun-hee. Persistent COVID-19 infections among children and teenagers are causing quite a bit of concern as education authorities prepare to fully open the academic arena next Monday after tomorrow's, that is Thursday's, nationwide college entrance exam. Now, we have more on this in a bit. I have Kwon Soa standing by first with the broader pandemic coverage. Right, Soa?
Right, Sunny. So COVID-19 cases this Wednesday have rebounded to above 3,000, and it is actually the second highest figure that Korea is seeing ever since the pandemic broke out. 3,187 cases were tallied as of 12 a.m. And that includes, most of them are domestic transmissions, apart from 24 cases from abroad. Now, that's a jump by more than 760 cases from the day before, and it is also an on-week surge when we compare the figure to last Wednesday, when the figure was at around 2,400. Now, what's also a big concern right now is the number of patients that are in critical or severe condition, which stands at 522, surpassing 500 for the first time, and that's also 27 more compared to yesterday. And throughout the week, that number has been in the 400s. So there were concerns that this could strain medical capacity once the figure hits above 500. And in the capital as whole, there's also been the highest number of daily infections reported this Wednesday at 1,436, close to 1,000 in Gyeonggi-do province. And most places across the country have reported a rise in cases compared to the day before. Also, Busan here has jumped to the triple digits. Let's move over now to our general updates here. The number of accumulated cases in the country has surpassed 402,000. The death toll stands at 3,158 with 21 additional fatalities. On the vaccination front, meanwhile, 42 million, or close to 82% of the nation's population, has received at least one COVID-19 dose, and 40.2 million are fully vaccinated, or 78.4%. Moving to figures abroad, there's been a similar rise in daily infections compared to the day before, more than 525,000, with over 707,000 new fatalities. And resurgences are happening in many European countries. The UK and Russia saw a similar rise in cases in the past day, close to 40,000, and also similar in Germany. Meanwhile, France has also reported a resurgence with close to 20,000 cases reported in the span of 24 hours. And those are the general updates I have for now, but I'll see you back in a bit. Sunny?
All right, so thank you for the global update in numbers. I now turn to Kim Yeon-seung for more on the latest developments with regard to the pandemic here on the local front. Yeon-seung, welcome.
Thank you for having me.
Right, so as Soa mentioned earlier, Korea has topped the 500 mark with regard to the number of critically ill patients. Let's start with that.
Right, so health authorities did say that one of the warning signs that shows that the nation's healthcare system is reaching its limit is if there were more than 500 critical patients. And on Wednesday, the country has surpassed that level. Critical cases are really taking a toll on the capital city's intensive care capacity, with more than 80% of ICU beds in this whole city being filled. That's up almost 2 percentage points from the day before. Beds are quickly filling up on a nationwide scale as well, with more than 60% of the beds occupied.
Right. Again then, Yeon-seung, as you've been saying throughout this week, I suppose authorities are turning to booster shots to address the situation.
Right, so authorities today had made a decision that would speed up booster shots for almost 14 million people nationwide. They're shortening the interval between primary and booster vaccine doses. The new plan recommends people in their 60s and over to get their extra jab at least 4 months after their final doses, and people in their 50s to get theirs after 5 months. Previously, authorities recommended people get top-up shots 6 months after being fully vaccinated, so the shots are being fast-tracked by 1 to 2 months. By doing so, health authorities are hoping to tackle the growing number of severe infections among the elderly and those with fading immunity. Along the lines of this decision, something really interesting came up during the briefing on Tuesday. Take a listen.
While there are only 8% of people in their 60s and over who are not fully vaccinated, They made up 61.7% of the total 452 deaths from October 3rd to November 6th.
So to put this in other words, unvaccinated seniors only make up around 3% of the country's population, but more than 60% of COVID-19 related deaths. This really goes to show how important vaccine protection is in keeping the elderly safe from infections and serious illnesses that could have fatal consequences.
Right, I see. Meanwhile, Yunsen, I hear there's been some advance in hopes of offering COVID-19 treatment pills to people in less privileged countries as well.
Right, exactly. So Pfizer has signed a deal that will allow generic versions of their COVID-19 pills named Paxlovid to be licensed to 95 low to middle income countries. The company is also waiving the royalty fee for these countries. Although the drug has not yet been distributed to the public as of yet, it has shown promising results in clinical trials and is seen as a potential game changer. The company is hoping that this drug will play a critical role in quelling the pandemic and saving lives in those lower income countries where there are more than half of the world's population. The drug is expected to be priced at around $700 US, but in lower income countries, that price tag will most likely be brought down. Pfizer's move, however, has been met with some criticism that some of the hardest hit countries like Russia, Turkey, and Brazil are not included in the deal.
I see. All right, Yunsen, thank you for now, but do stay behind for the extended talk. Right, earlier on this Wednesday morning, health authorities addressed the current COVID-19 situation in light of the relentless spread of the virus here and the spike in the number of severely ill patients. I have Sua back at the desk. Sua, what is the latest government assessment then?
Well, Sunny, let's start with the latest stance on how serious this really is or not. So noting that we are in the third week of phase 1 in our gradual return to our normal lives, officials say there are some trends that were widely expected, but others not that much. So this is what a ministry official had to say earlier this morning.
We believe that a rise in the overall case counts is a somewhat inevitable part of our gradual return to normal. Keeping this in mind, it is our assessment that the current rising trend in the number of cases and the scale of transmissions are within our expected range. However, the number of seriously ill patients is rising at a much quicker pace compared to the overall case counts.
Now, regarding the gradual return to normal, Son requested people, especially Korean media, to refrain from using the term "with corona," which is still widely used, citing that concerns that it could wrongly suggest a drastic easing of prevention measures. Let's take a listen.
Our phased return to normality does not mean we're completely abandoning our existing prevention efforts, such as social distancing, but rather a gradual easing of rules within levels that can be managed by our healthcare system. It signifies a return to our normal activities with safety in mind.
Right, and so speaking about the healthcare system, I understand the Prime Minister has expressed concerns about the treatment of critically ill patients at the moment.
So Yunsen touched upon the availability of ICU beds for people in serious or critical condition, which according to Prime Minister Kim Buk-yeom is dropping at a fast speed. He noted that there is enough nationwide capacity, but in the capital region, it's already a day-to-day struggle. And with that, he made this call.
We've found that the number of ICU beds that are currently being used is excessive when compared to the number of seriously ill patients. There are many reasons for this, depending on the situation on the ground, but we ask that beds be allocated based on accurate medical diagnosis and that patients also be discharged quickly if their conditions have sufficiently improved.
Right, and also to ease the medical burden, I understand that patients with no or mild symptoms, for them, the government has shared detailed measures for home treatment as well.
Exactly. So while the government has revised its criteria for home treatment a few times and has also been strengthening its monitoring of patients that are recovering at home, there's also always the chance of asymptomatic patients developing more serious symptoms. And in that case, they have to be hospitalized. hospitalized. So the emergency transport system for people being treated at home has been discussed at the earlier government briefing this Wednesday. So a total of 1,581 119 ambulances across the nation, including 295 specifically designated for virus patients, are on standby to depart anytime. And these are also in charge of getting patients being treated at home to hospitals in case of an emergency situation. In case of common COVID-19 symptoms, community health center or private ambulances are to take care of patients, while state-run 119 ambulances will transport patients in a more urgent situation, such as with breathing difficulties or fading consciousness, and also in cases in which the severity of the illness cannot be determined. Also, 24-hour hotlines are operating between local 119 emergency services and home treatment management teams, so that information of home treatment patients can be shared efficiently for tailored treatment. And this systemization will help transfer patients in an emergency situation faster and also in a more efficient manner. And officials are stressing, however, it won't affect the normal operation of existing emergency services.
Right, well, that is reassuring to know. Let's now revisit the topic of booster shots, Yun-Sung. So Korea has shortened the dosing interval for booster shots for those in their 60s and 50s, as you mentioned earlier. Is this measure also in practice elsewhere?
Well, not in many countries. Actually, I want to mention how big this is for health authorities to narrow the interval between the booster jab and the final dose into 4 months, because not many other countries have really taken this step before. So Japan actually also recently reduced the booster gap, but it was lowered from 8 to 6 months. And Canada and the EU also recommended a 6-month wait for the people who got their jabs earlier. Hungary, it's actually one of the first countries to start the booster campaign in Europe. They were the few countries that shortened their booster gaps into 4 months, but they've only done so after realizing that the Chinese-developed Sinopharm vaccines didn't offer a robust protection in protecting against the virus. And
also, as you mentioned, Japan before, there was also a decision that beginning next month, there will be booster shots available for medical staff aged 18 and above. So it's not only about that shortening of the interval, but also expanding the age group of the booster shot campaign.
Right, good to know.
Yeah, so going back to what I said, so it's really easy to see how seriously the current South Korean health authorities are taking this situation. Health officials are really trying to provide that extra layer of protection to the people who have fading immunity so that the virus doesn't have a chance to seep through the elderly.
Right, because many of the elderly here received their vaccines earlier on this year. Now, on the local front then, so aside from shortening the interval for booster shots, as Yun-Sung mentioned, what other plans are in the works to expand public vaccination?
Well, first off, Sunny, more booster shots in the military are going to be administered starting next week. That would be next Wednesday. And the government will start with military personnel, with medical staff within the military personnel, with around 3,000 people to receive booster shots starting on Wednesday next week. And for some regular 500,000 troops, the booster shot campaign will also start in a few months in January. And the Defense Ministry actually mentioned that this Wednesday there were also 12 new COVID-19 patients that occurred in the military. We have recently only mostly spoken about cluster infections at medical facilities of nursing hospitals, nursing homes, so where many seniors reside, as well as among younger teenagers or children. But there are still cluster infections also happening within the military, so we will have expanded booster shots there. And now there are also talks about when the regular citizens, so regular citizens aged 18 to 49 will receive their booster shots. So experts are saying that might even start around spring, but we will have to have more further information from the government related on that. Now, meanwhile, there have been some 136,400 booster shots administered yesterday, which would be Tuesday, and more than 1.3 million booster shots have been administered so far. One thing I also want to mention is that the Son Young-nae, the official at the earlier government briefing, mentioned that we should call this here in Korea additional shots rather than defining it as booster shots. But it's a different story when we report it in English.
Oh, I see. All right. Right then. Thank you so much for that. I'll see you again tomorrow. And Yeon-sung, I'll see you back on Thursday as well. Final preparations for underway, that is, for Korea's annual college entrance exam, Suneung, which takes place tomorrow, that is Thursday. Our Kim Hyo-sun has more on what to expect.
Face masks will be mandatory for all test takers of the college entrance exam that takes place across South Korea on November 18th. This year's test is the second since the onset of the pandemic. While the students are permitted to wear ordinary disposable hygiene masks, they are advised to wear government-certified medical masks such as KF94, KF80, or KFAD. Masks with valves and those made out of mesh are not allowed as they do not effectively block respiratory droplets. Test takers who have COVID-19 or are in self-quarantine for possible exposure have already been assigned to separate testing sites and will be required to wear KF94 masks.
The fact high school seniors have been inoculated and will have no dividers at test sites means we've already come a long way compared to last year.
Test takers will be asked to install the plastic dividers on their desks before lunch, which they'll be asked to return once they've finished eating. As there will be no water purifiers, test takers need to bring their own water along with a packed lunch. They're also advised to wear extra warm clothes since windows will be opened every hour to ensure the natural flow of air to minimize the risk of COVID-19 infection. Test takers should also know that all electronic devices are prohibited at test centers, and that includes smartphones and micro-sized wireless earphones. Kim Hyo-sun, Arirang News.
President Moon Jae-in is poised to host talks with his Costa Rican counterpart next week. The upcoming summit follows an invitation by President Moon to Costa Rican President Carlos Alvarado for a state visit between November 21st and the 24th, ahead of the 60th anniversary of diplomatic ties next year. The Blue House says the two leaders will likely touch upon productive collaboration on many fronts, including health, agriculture, space and hydrogen economy. Now, Mr. Alvarado's trip to Seoul will be his first to Asia since taking office in May 2018. Over in Washington, diplomats from South Korea and the U.S. have reaffirmed their dedication to regional peace and prosperity and to efforts to better engage North Korea. Pyeonji reports.
South Korea's Vice Foreign Minister Choi Jong-gun held talks with his U.S. counterpart Wendy Sherman in Washington on Tuesday U.S. local time. Seoul's foreign ministry said the two diplomats decided to continue discussions on ways to bring North Korea back to the negotiating table. The ministry said that the latest meeting, which lasted for an hour, covered a wide variety of issues, including the U.S.-Korea alliance and issues on the Korean peninsula, and that both sides agreed to continue cooperating on vaccines and global supply chains. It also said there were negotiations on the issue between South Korea and Iran. This is likely a reference to the $7 billion worth of Iranian assets currently locked in South Korean banks due to U.S. sanctions. Choi said South Korea will continue the diplomatic supports needed to resolve issues regarding Iran nuclear deal. The U.S. State Department also released a statement saying that Sherman and Choi reaffirmed the U.S.-Korea alliance as the linchpin of peace, security, and prosperity in the Indo-Pacific region and beyond. It also said the two discussed North Korea and shared commitment to the complete denuclearization of the Korean peninsula. Tuesday's bilateral meeting came a day before the U.S. and South Korean diplomats were set to be joined by their Japanese counterpart, Takeo Mori, for trilateral talks. Pyeonji, Arirang News.
Back on the local front, corporate spending appears to be gaining ground with findings for the first 9 months of this year showing a rise of over 7% on year. Kim Do-yeon has more.
Major businesses in South Korea have spent more investment so far this year compared to the same period last year, possibly suggesting that they're trying to jump back from the COVID-19 pandemic. This is according to South Korean corporate tracker CEO Score. According to the tracker, the combined capital spending of 336 of the top 500 companies hit $105 billion from January to September this year, jumping more than 7% on year. Firms in IT and electronics had the biggest jump, with more than $10 billion compared to the same period last year. The biggest spender by far was Samsung Electronics with $31 billion of investment, up more than 25% on year. Next came chipmaker SK Hynix at around $2 billion. Pharmaceuticals, food, and logistics industries also showed a slight increase in their spending. But industries such as shipbuilding, automobiles, and petrochemicals slowed down on their investment, suggesting these industries are not completely out of the impact of the pandemic. Experts say that the increase in investment comes mainly due to the base effect from when COVID-19 hit companies last year.
South Korean firms' facility investments weren't really on an upward trend even before COVID-19. It wasn't increasing much. But because there was an even bigger dip due to COVID-19, now we're going back to the level we were at before.
As for the employment rate, CEO Score says a total of 301 large companies had a combined workforce of 1.16 million as of end of September this year, up 0.45% from a year earlier. Kim Do-yeon, Arirang News.
Sesame Street, a long-time favorite among children and adults across the globe, is introducing its first ever Asian American character. Our Kim Bo-kyung tells us about her.
Meet 7-year-old Ji-young, the very first Asian American resident of Sesame Street.
Actually, there's something really cool about my name. So in Korean, traditionally, the two syllables, they each mean something different. And Chi means like smart or wise, and young means like brave or courageous or strong. Yeah.
Just a young kid who likes playing the electric guitar and cooking with her grandma, but Ji-young is already making history as the first Asian American Muppet featured on Sesame Street in the show's 50-year history. The new Asian American character is a part of the organization's ongoing racial justice initiative called Coming Together, which was introduced in the summer of 2020 after the murder of George Floyd and as racism and violence targeting Asians and Asian Americans surged during the pandemic. Some of Ji-young's personality actually comes from Ji-young's own puppeteer, Caitlin Kim. This 41-year-old Korean American got into puppetry in her 30s, and in 2014, she was accepted into a Sesame Street workshop. The new character is the culmination of a lot of discussions following the many race-related hate crimes that took place in 2020, and so Kim hopes that Ji-young's existence can deliver a message of inclusivity.
My one hope, obviously, is to have Ji-young help teach, what racism is, help teach kids to be able to recognize it and then speak out against it. But then my other hope for Ji-young is that she just normalizes seeing different kinds of looking kids on TV.
Ji-young will be formally introduced in the Sesame Street special called See Us Coming Together, which will air on Thanksgiving Day, November 25th, on HBO Max, Sesame Street's social media platforms, and on local PBS stations. Kim Bo-kyung, Arirang News.
Let's take a look at what's going on in the world now. Russia on Tuesday confirmed that it conducted a missile test targeting an old space satellite, blowing up their target and creating debris that forced the International Space Station crew to shelter in capsules. In response, Washington condemned Moscow's action, calling it a dangerous and irresponsible missile test.
Russia's dangerous and irresponsible behavior jeopardizes the long-term sustainability of outer space and clearly demonstrates that Russia's claims of opposing the weaponization of space are disingenuous and hypocritical. The United States will work with our allies and partners to respond to Russia's irresponsible act.
Experts also say that weapons that shatter satellites pose a space hazard, as the resulting clouds of fragments can collide with other objects, setting off a chain reaction of projectiles through the Earth's orbit. The latest missile test reportedly created more than 1,500 pieces of orbital debris. However, in response, the Russian Space Agency downplayed the situation, saying that the missile test was incident-free. The satellite targeted for the test was the Cosmos 1408, a spy satellite launched in 1982, which stopped working many years ago. Myanmar's military authorities continue to add fresh charges against the ousted leader Aung San Suu Kyi, as well as members of her administration. According to a state media announcement on Tuesday, the Nobel Prize winner is now facing a new electoral fraud charge, along with 15 others. The 76-year-old faces 11 criminal charges, including 2 for corruption and 1 for violating the Official Secrets Act, which could see her sentenced to a maximum of more than 100 years in prison. She has been held captive by the military since the February coup, when the military justified their takeover by accusing her government of obtaining a landslide election victory through a manipulated vote. Bitcoin on Tuesday slipped below $60,000, seeing losses from a record high of $69,000 recorded a week earlier. The world's biggest cryptocurrency saw its price drop to as low as $58,568, the lowest in more than 2 weeks. Ethereum also saw a huge drop in prices, down 6.8% at one point. Analysts say they can't pinpoint any particular news driving the massive declines, but added it seems to be driven by profit-taking after a recent sharp run-up. Bitcoin has still more than doubled in value since June, thanks to mainstream adoption of cryptocurrencies. Lee Seung-jae, Arirang News.
Advances in self-driving technology have paved the path to a pilot project in the city of Sehung, where officials are offering autonomous rides to and from a number of remote neighborhoods. Do take a look.
Fully automated vehicles drive themselves without human driver input. And now, self-driving cars are no longer science fiction, but rather are becoming a part of our everyday life.
Today, I'm at a new town located in Gyeonggi-do province. At here, the autonomous driving mobility service is currently being piloted. So let me present the request and see how it is working.
This is a new town in Sehung City, Gyeonggi-do province. Residents have experienced much inconvenience as the intervals between buses are too long and the operation ends early. Thanks to the autonomous mobility service, however, the inconvenience is gradually being resolved. Shortly after a request was made via the mobile app, the self-driving car arrived. Self-driving cars can drive on their own, it stops at the stop line, and it even makes a perfect U-turn. But this car still needs a person in the driver's seat to oversee the drive.
보행자가 이제 길을 건너고 있을 때도 그 라이다가 인지를 해서 안전하긴 한데 그래도 한 번 더 운전자가 꼼꼼하게 체크해야 됩니다. 가장 중요한 부분이기 때문에.
Meanwhile, the control center responds to ride requests, send the vehicle, and oversee the overall ride.
밤 10시 반 정도 이후에는 대중교통이 끊어져요. 쉽게 말해서 그 버스가 끊어지면은 택시만 있는데 수요 응답형으로 소비자가 자율차를 앱으로 부르면은 10분 이내에 달려가가지고 목적지까지 태워주는 그런 좋은 장점이 있습니다.
The service has gotten very positive feedback from the passengers. In a survey of passengers, 9 out of 10 said they think self-driving mobility services are innovative and are willing to use their service again.
부르면 호출하면 달려와주는 무인 자동차 마중 서비스가 운영이 되고 있어서 안전하고 편안하게 집에 귀가할 수 있었습니다.
The COVID-19 outbreak accelerated the development of self-driving vehicles, and with this, many experts are trying to lead technological development in various ways.
자율주행 자동차의 제일 중요한 거는 인공지능이 되게 중요한데 이런 디지털 전환이 아주 촉진되면서 이 AI 기술이 굉장히 활성화해졌습니다. 그래서 실제로 자기가 주행을 하면서 주행 기록을 이제 AI가 학습을 해서 다음 주행 때 좀 더 진보된 자율주행을 할 수도 있는 그런 경우도 있고요.
Then where does the technology of self-driving cars currently stand? The Society of Automotive Engineers defines 6 levels of driving automation ranging from 0 to 5. And the one that you're seeing right now is at level 3. Experts say that getting to the fully autonomous level should take more time.
자동차는 컴퓨터하고 틀립니다. 한번 에러가 나거나 고장이 나면 바로 사고가 직결이 됩니다. 그래서 소프트웨어 기반의 어떠한 그 안전도를 확보하는 것이 제일 중요하다고 생각을 하고요.
현재 레벨 3 수준에서 레벨 4, 5 이상 그 수준에 다가가게 된다면은 모든 시민들이 그리고 또 운전을 못하는 사람들 포함해서 또 그 나이가 많이 드셔서 운전을 못하는 경우에도 그런 분들에게도 많은 도움을 주게 될 것이고 자율주행을 통해서 그 뭐 배송이라든가 다양한 서비스의 접목이 될 수 있으리라고 봅니다.
Once the self-driving mobility service gets widely available in the future, it is expected that it would provide a more convenient mobility option to those who are living in areas with insufficient transport infrastructure. This has been 신세벽.
Come tomorrow, that would be Thursday, November 18th, Korea will host its second college entrance exam amid the pandemic. And come next Monday, the academic arena nationwide will fully open its doors. For more on these events and their likely repercussions, as well as potential countermeasures, I have Professor Kim Moon-gyu from Yonsei University. Welcome back, Professor Kim.
Thank you for having me.
I also have Professor Sarah Ok-shin from Korea University. Professor Shin, it's been a while.
Yeah, thank you for having me.
Meanwhile, joining the session virtually is Professor Peter Chin-hong at the University of California, San Francisco. It's a pleasure to have you back, Professor Chin-hong.
Always a pleasure, Sunny. Thank you.
Right. Professor Kim, we'll start here in the studio then. What are your prospects on the potential spread of the virus after Suneung?
Well, the Suneung itself might not be a spreading cause, even though it's a nationwide event. All the students are going to sit down and keep distance, and they're going to have a regular ventilation, and they're not going to talk or move around. So, but if the people are going to gather after the exam or outside the school, or there might be a factor, but I don't think that's going to exacerbate the situation. If we look back last year, 2020, the exam date was December 3rd, and there was a mild surge after the exam, but and it was regarded as a third wave, but it's not clear whether it's because of that exam. Maybe there was some other factors, such as Alpha variant spreading and the weather factor. Possibly there might be a mild increase after the exam if there is any reason related to Suneung, but regardless of this exam, I think there's a high possibility we're going to have a high surge already in this situation. Yeah.
Right, because we've had our second highest daily tally on this Wednesday.
Correct.
Professor Chin-hong, I hear the pandemic has prompted changes in college admission requirements as well as practices over in the US. Could you tell us a bit more about this, Professor Chin-hong?
Well, Sunny, I think the innovation during COVID for standardized testing and college entrance exams was probably rethinking whether or not they were necessary at all. In fact, many colleges and universities became test optional during the pandemic. They still are. Many of that policy has been extended an additional year. There was an attempt at having remote proctoring, but that was discontinued because of fears of security. Other lower stakes exams were open books. So I think we reevaluated whether or not we needed these standardized exams.
And how has that affected the application process itself? How are students responding to that, the absence of standardized tests?
Students responded very dramatically with increase in applications to individual colleges by 30 to 50%, which led to increased work by admissions officers and increased uncertainty as to what percentage of students accepted would actually go to the college that they were accepted to.
I see. Meanwhile, back on the local front, Professor Shin, 1 out of every 5 new infections in recent days involves a minor. Now, do you see the prevalence of teenage transmissions here on the local front as perhaps affecting our efforts to transition into a new normal?
Yeah, so as you know, children and teenagers spend a lot of time together in school or outside of school doing lots of different activities. So I think the increased numbers of infections in children and teenagers will inevitably rise, and the confirmed cases among general populations will also increase in numbers as well. So although the government claims that it can handle up to 500 severe cases under current medical system, the ICU bed availability in Seoul area is not so good, right? So it has surpassed over 75% threshold. So I think that the increased numbers of these infections in children and teenagers are definitely not a good sign, and it's a growing concern and potential threat for living with the COVID-19 policies.
Right, and because of that concern, Professor Kim, health authorities are now strongly recommending inoculations, COVID-19 inoculations for those aged 12 to 17. What are your thoughts?
Very difficult question. In USA, there are already more than 490 deaths in the age group from 0 to 17 because of COVID-19, and FDA authorized Pfizer vaccine for the age group 12 to 15 in a phase 3 trial, including more than 2,000 children. And CDC reports that you're going to have a 93% less chance to get hospitalized if you get vaccinated. And now they already started the program for 5 to 11 in the United States. When we look at Korea, the Korean Society of Pediatrics recommends that this vaccine is necessary for children with risk factors like diabetes, high obesity, etc. But for healthy children, what do you do with them? We need the understanding from the parents. They recommend it. But there are 2 factors very important in this issue. We have no fatality less than 20 in Korea. That means we have a very good quarantine measures. So well, if the pediatric cases increase, we might have a similar phenomenon like the United States and other countries, and that might be a reason for vaccination. But there's data that when you screen our Korean population, the antibody positive rate is still less than 1%. And if I compare with Germany, they say the antibody positive rate in general population is between 15 to 20. So we have to think about the safety issue of this vaccination. It's not settled down yet because we don't have enough data, and all the available data are only short-term. We don't have a long-term results yet. And if you want to vaccinate for children, we have to look for more than 10 years, 20 years, even 30 years for the safety. Especially if we continue to have a zero mortality of COVID-19 in children, it's going to be very difficult to persuade the parents. I mean, the reason we have to get this vaccination done for children.
I see, and we'll touch upon that in a little bit. But first, Professor Chin Hong, Professor Kim just touched upon very briefly about the situation over in the US. What more can you tell us about transmissions among teenagers and children there, and where authorities, of course, as Professor Kim mentioned, recently launched vaccinations for those aged 5 to 11?
Well, I agree with everything that Professor Kim said. I think in the US, there were probably 3 reasons why there was a rationale for immunizing adolescents and then younger kids. A lot of it was driven by the increasing cases. And during the Delta era, more than 200% increase in cases, more than 2 million infections in the US in that age group, resulting in more than 800 hospitalizations and several hundred deaths. So I think that there was a lot of rationale for it. More than that, it also disrupted a lot of in-person schools. So more than 2,000 schools had disruptions in classes because some student was positive, and then because of contact tracing, the other students had to leave and go home and be isolated or quarantined. So that's the second. And third, there was increasing recognition that these kids would bring infection into the households, even though they wouldn't get sick themselves, but then spread it to potentially vulnerable people. So I think those are the rationales that were used. I think regardless, there was increasing fatigue and mental exhaustion as well in these kids, long COVID and multi-system inflammatory disease. All of that led to more burden of disease than we originally thought pre-Delta.
And has such rationale, the 3 that you mentioned, encouraged guardians to perhaps inoculate their children? What is the inoculation rate among children there?
So not high universally in the US, but about 50% uptake in adolescents aged 12 to 16. But in San Francisco Bay Area, for example, and in Marin County, just north of us, it's more than 90%. And in fact, that high adolescent rate was cited as a reason why our young kids in the unimmunized group so far at that point early in the year, there weren't any intra-school transmissions because there were so many people immunized around those 5 to 11-year-olds.
I see. Professor Shin, what now? I mean, Professor Kim has mentioned that we have not lost a life among those below the age of 20, I believe you said. Now, having said that, Professor Shin, what are the risks of severe illness then among teenagers and children here in Korea?
What other severe illnesses?
Right. Have we had any cases of children or teenagers developing critical or serious symptoms upon infection?
So as far as I know, I haven't really seen many severe cases in children or teenagers. Mostly they have asymptomatic cases, or even if they have symptoms, it's very mild. But still, there's some concerns over these children and teenagers being able to transmit the virus. So that's another.
Do you suppose the reality that we haven't had a lot of severe cases within teenagers and children, perhaps that reality is keeping our parents, our guardians that is, from inoculating their children?
Yeah, that is likely the case. And plus, I think that the government hasn't been giving out more clear message, or rather they have been a little bit passive in encouraging the parents to get the vaccination for children and teenagers. And so that might have something to do with why the parents are more hesitant over getting the vaccination for children, because of there could be possible side effects. But we still have unvaccinated groups in adults and the elderly, and we just started doing the booster shots for the elderly. And the vaccine-induced immunity is waning in general population. So I think that this children and teenager infection cases could be a trigger for the severity increase in adults.
Right. And Professor Kim, going back to something that Professor Shin mentioned, there are concerns over possible side effects with regard to mRNA vaccines, which, well, the Pfizer one that is being offered to children here on the local front. Do address these concerns for us, and also do tell us about the possible ways to tackle them, including myocarditis.
Yes. Yeah. RNA vaccine is a totally new vaccine that we have, and we need long time to monitor and care about the side effects, short-term and long-term. Usually they say they have a pain on the site, injection site, and they have fever, and they may feel some muscle pain and fatigue. Recently, now we understand the most serious side effect is myocarditis. Usually happens after, within 7 days after the second shot. So, when does it happen? I think most of them seriously happen in males in their second or third decade. And the symptoms are chest pain and dyspnea and sometimes palpitation or general weakness. So if you have this kind of symptom within 7 days of the second shot, you have to see the doctors. And actually, many patients come to outpatient clinic, emergency department, and this morning I saw a 17-year-old student visited because of exactly those symptoms, chest pain and palpitation, and he was within 7 days of the second shot. But and actually, it was already reported as a side effect of that RNA vaccination. But when I saw him, I realized that he was having chickenpox. So people are too preoccupied with those RNA vaccines. But anyway, sometimes it is something different. Anyway, if you have myocarditis, you better stay in hospital, and they're going to start treatment according to your symptom, and they will let your heart to rest. If it doesn't come back, they will go further for some intensive cares, but usually they recover. So even though you have myocarditis, and if you visit the see the doctor in within a short period, it's not that much to worry about.
Right, well, that is good to know. Professor Chin Hong, going back to your talk about losing several hundreds of lives among the young in the U.S. to COVID-19, were most of these patients suffering from existing health conditions?
Yes, so most of them were. So if you look at the hospitalization rate in the general adolescent and children population, it's 2 to 4%. But if you add comorbidities like obesity or diabetes or congenital heart disease, it goes up to about 25%. And in fact, if you compare the hospitalization in the US and the UK, it's much higher in the US as a percentage. And several people have proposed that that reason is because there's more obesity in the US, there's more diabetes in the US compared to similar populations around the world.
I see. And Professor Shin, there is talk about a greater viral load within children patients. Could you explain this for us?
Yeah, I think you're referring to a study that just came out from Journal of Infectious Disease. So there was some interesting findings there. So many people thought that this is unapproved, but there's an assumption that children are less likely to get infected or transmit the virus. But not enough studies were done actually to look at the effect of children in viral transmission at a large scale level. And in this study, the authors have found that regardless of symptoms or disease severity, these children can carry, that are infected with COVID-19 can carry high load of virus, self-replicating viruses, that is. And that can create a potential reservoir for viral transmission and also, the evolution of the genetic variants from there. So we can learn from this study that children can have a potential to serve as new source of, spreading new infections in the community. And so, as the vaccine-induced immunity wanes in a general population, this could be a concern.
Right. Mm-hmm. Professor Kim, there are efforts here to better protect our children, and as part of one such effort, there is a requirement of vaccine passes for access to daycare centers in the country. What are your thoughts on this?
Vaccine pass was introduced to booster some general population to get vaccinated. And what is it for? I mean, for whom is it we are trying to get the children vaccination? If it's for the adults, I think we need more effort to get the elder people get vaccinated. get booster shots. And if there's a kind of discrimination between children because of that vaccine pass, we have to rethink about it. And I would like to put emphasis on the high-risk group for children, the children who must get vaccinated. They are type 1 diabetes patients and patients with high obesity and children with congenital heart disease and children with seizure disorders like epilepsy. Those are the children who must get vaccinated. Actually, it's not easy because let's say there's a child with congenital heart disease and this RNA vaccine might cause myocarditis. So they are not willing, they are reluctant, they worry a lot about their children. So it's the doctor's job to explain and persuade them to get vaccinated, because if they're going to get COVID-19, they might end up with a severe case. And the second thing I want to say is the basic vaccinations. Children must get vaccinated. Usually they end up within 5 to 6 years, but I say that basic vaccination should not have less priority against COVID-19. If the vaccine day comes, you should get vaccinated. You know, in USA there's a big report about the non-COVID mortality decreased in vaccinated population. That means if you get COVID-19 vaccination, your mortality for other reasons is also lowered. What does that mean? I mean, COVID-19 vaccination is doing something non-specific good for people. So I think the basic vaccination for children is helping children getting immune. I mean, non-specific immunity is boosted. So I say that the basic vaccination is also important. You must not put priority on the COVID-19.
Right, so essentially vaccinations for all diseases are very important. For COVID-19, if you have a pre-existing health condition, you are a child, it would be advisable for you to get one.
Yes.
All right, Professor Kim, as always, thank you very much for your thoughts. Professor Chin Hong, thank you very much for your time and your thoughts. And Professor Shin here in the studio, thank you for your insights.
Thank you.
Right, well, that ends this edition of the Daily Report. For those of you taking the college entrance exam on Thursday, that is tomorrow, best of luck. And for the rest of our viewers, do take care amid the pandemic. Thank you for watching.